Are you navigating just a sea of information, wishing someone could filter it all down, just hand you the most vital insights? Well, you've definitely found the right place. Today, in a deep dive, our mission is exactly that. We've gone through a stack of sources, everything from the latest industry reports and academic research to some really compelling expert interviews, all focused on one of the most transformative topics shaping our world right now, artificial intelligence in healthcare. We're going to pull back the curtain on the incredible promises AI holds, the very real hurdles standing in its way, and maybe most importantly, the profound human considerations that are going to define its future role in health. Think of this as your essential guide, your shortcut, really, to truly grasping what's happening and what's at stake. So let's get into it. Okay, to begin, let's maybe unpack this a bit. What exactly do we mean by AI, and what's the sort of overarching vision for it in healthcare? At its heart, AI is it's about designing machines, intelligent machines, right? Ones that can mimic human thinking, like learning and problem solving using complex algorithms.
Its real power, its core strength, lies in its ability to learn super fast and recognize patterns from these huge, complex data sets. Like, imagine an AI taking a whole patient history, tons of data, and instantly distilling it into maybe one key insight, like a probable diagnosis. It's powerful stuff.
Yeah, and it's really crucial to remember AI isn't just one single thing, right? It's a broad field, lots of specialized areas. Machine learning is a really big one. And within machine learning, we often talk about a few key approaches. Take supervised learning, for example. It's like learning with a very specific teacher, you could say. The AI gets trained on data that's already labeled. Think X-ray images already marked up with known tumors, so it learns to find new ones. Then you've got unsupervised learning. That's where the AI sifts through unlabeled data, kind of looking for hidden patterns on its own, almost like grouping patients who have similar, maybe unexplained symptoms, trying to find a common thread. And finally, there's reinforcement learning, RL. This is behind a lot of the really big AI breakthroughs we've seen lately. Here, the AI learns by trial and error, essentially. It gets rewards for doing the right actions, a bit like teaching a robot to navigate a maze or even training a pet.
Okay, that gives us a fantastic picture of how these systems actually, learn. But what does this look like in practice, in our clinics, our hospitals? Not just in theory, but day to day. Our sources, they map out a pretty widespread adoption of AI in healthcare. Not all at once, though. It's over different timelines. And these aren't exact predictions, maybe more like signposts for where things seem to be heading. So in the short term, like the next 0 to 5 years, we're already seeing or expect to see a lot more of the Internet of Things, IoT, in healthcare. Connected devices, also things like virtual assistants, expanded telehealth, which we saw boom recently, and more personalized mental health support. Precision imaging, too, like detecting diabetic eye disease early or planning cancer radiation treatments more effectively. Even cutting-edge stuff like CRISPR gene editing tools will see more use, powered by AI insights. So right now, in this immediate future, AI is really about automating those repetitive, high-volume tasks that just eat up so much valuable time.
Right. And looking a bit further out, maybe 5 to 10 years from now, we expect to see a significant jump in what's called ambient intelligence in healthcare settings. Just imagine like wireless sensors, totally touchless, maybe like the Emerald system, discreetly monitoring sleep patterns, breathing, even subtle changes in movement or behavior. Or think about devices like, say, Google Nest, potentially monitoring coughs just using motion and sound, or smart speakers detecting heart rhythms without any physical contact. It's quite something. We'll also see much larger scale precision imaging alongside really exciting developments in synthetic biology and immunomics, which is basically studying our immune systems at a super detailed molecular level. All this, it's going to lead to much more customized healthcare and increasingly sophisticated robotic-assisted therapies as well. So in this medium term, AI really starts leveraging multiple types of data, what we call multimodal data sets, to drive these highly precise treatments.
And then, okay, looking beyond 10 years, the long-term vision painted by our sources, it's nothing short of transformative, really. Picture this: autonomous virtual health assistants, delivering proactive, maybe even anticipatory care before you even realize you need it. Healthcare organizations could become completely seamlessly networked, operating on one single connected digital infrastructure. Imagine that efficiency. We're talking holographic imaging, hybrid imaging, holomics, which sounds futuristic, but it's integrating all our omics data, like genomics, proteomics, a whole picture of our biology. This leads to truly personalized genomic medicine, AI actually driving drug discovery, finding new cures for diseases, treatments that honestly sound like science fiction right now. In this future, AI isn't just assisting, it's genuinely empowering healthcare professionals, maybe even through things like digital twins of individual patients. leading to incredibly precise medicine and hopefully significantly improving health equity around the world. And these aren't just pie-in-the-sky dreams. We're already seeing real-world success stories starting to emerge. Take mental health, for instance. We all know there's this rapidly growing demand for services, right? But access is often restricted, and there just aren't enough professionals to meet the need. I mean, in the UK, some kids are waiting over a year just for their first appointment. It's a crisis. So our sources show how AI is being explored pretty actively to expand access and improve diagnosis and treatment for things like anxiety, depression, psychosis, even dementia. This includes things like chatbots, which are becoming quite common for managing, say, depression and anxiety symptoms. Also virtual reality applications, avatar therapy for psychosis, even humanoid robots helping out with therapy for children or maybe isolated elderly people, and animal-like robots, companion robots, for dementia patients, plus digital game interventions designed for young people. Lots of different approaches. Now, initial findings, they've often been positive. Usually no adverse side effects reported, which is good. But it's fair to say the data quality is often still a bit low, a bit varied, and we don't always have clear long-term effects documented yet. So, work in progress.
That's a really crucial point, isn't it? About the journey from promising research to widespread, sustained clinical impact. It takes time. But beyond those sort of grander applications, AI is also showing immediate practical benefits, just streamlining workflows. Consider the Sano AI transcription tool. We looked at Dr. Erin Leesberg's experience, a staff physician. She admitted she was pretty skeptical at first, but she quickly found it did a great job concisely transcribing her patient conversations. It drastically cut down the time she spent typing up clinical notes afterwards. Now, apparently, she uses it for basically all her patient encounters. That's quite a turnaround.
Yeah, Dr. Leesberg's experience, it's a perfect illustration, isn't it, how integrating AI into an existing familiar workflow, like taking notes, something doctors are already comfortable with, maybe dictating notes, that really helps with adoption. It's been like how digital assistants in call centers can instantly pull up relevant info for the agents while they're on a call. Just fits into their existing process, makes it smoother. And beyond just notes, AI is also speeding up precision medicine. We touched on this. It can lead to more accurate diagnoses, maybe predict disease risk before symptoms even show up, and help craft truly customized treatment plans. We saw this really compelling example, an algorithm for predicting breast cancer. It was trained on, over 38,000 mammogram images and health record data from over 9,600 women. Huge data set. And the results, it performed comparably to human radiologists. And it had the potential to substantially reduce misdiagnoses. That's a monumental step forward for patient care, potentially. These are genuinely exciting possibilities, no doubt about it. But it's also really clear that bringing AI into healthcare, it comes with its own set of pretty serious challenges that we need to face head on.
Absolutely. And what's fascinating here, I think, is that a lot of these challenges, they aren't just technical hurdles. They involve people, processes, and really a fundamental shift in how organizations operate. One major hurdle is just defining and measuring success in the first place. Researcher Farah points out organizations have historically struggled with this. Setting clear benchmarks from the start, tracking progress, making sure the value they thought they'd get from AI is actually being realized. The solution here seems pretty critical, setting up a proper multidisciplinary AI governance structure. This team, it needs everyone at the table, clinicians, business leaders, finance execs, to identify the best use cases, oversee the projects, track progress, and measure the impact across all the important dimensions, not just the techie stuff.
Absolutely. And it's not just about knowing what to measure, is it? Many health IT experts, like Dr. Scott Shell, they consistently point to data fragmentation as a huge challenge. Maybe the primary challenge. I mean, just think about it. Patient data is scattered everywhere. Different systems, different locations, different formats. It's like a babel of technical dialects, someone called it. You've got different standards, ICD-11, LOINC, SNOMED, CT, all speaking slightly different languages. This makes the data incredibly difficult for AI models to actually use effectively. Often leads to poor results, or worse, what some call junk in, junk out. Garbage data leads to garbage insights. For AI to be trained properly, and crucially to avoid these things called hallucinations, where the AI basically makes stuff up confidently, it needs reliable, consistent, clean data.
Yeah, exactly. To tackle this, there is a promising approach in adopting standardized healthcare data models, like creating a common language. Dr. Shell, he sees the Observational Medical Outcomes Partnership, or OMOP, Common Data Model, as particularly promising. It's essentially like a universal template, funneling all that fragmented data into a format that AI can actually understand and use reliably. There are others, too, like the Clinical Data Interchange Standards Consortium, CDISC, and the National Patient-Centered Clinical Research Network, PC Hornet, they all aim for similar goals. And, even when an AI solution seems great out of the box, there's almost always room for improvement in the real world. We saw this with that Suno AI tool, again, Dr. Lise Borker, who loves it now, right? She still said she hoped for better performance with really long, complicated patient histories where maybe the notes were minimal. This isn't really a criticism of the tool. It just highlights that ongoing need for vendors to keep listening to customer feedback, keep improving the product, leads to lots of new versions, iterations. It's a constant cycle.
And finally, perhaps one of the biggest challenges is guiding employees through this huge transition. Integrating AI isn't just plugging in a machine. As expert Darren Challender notes, AI and workflow automation, they lead to very different ways of working for clinical and administration teams. That's a big shift. And this, understandably, brings up fears, doesn't it? Fears about skills becoming obsolete or roles changing dramatically, maybe even being eliminated entirely. So robust training programs and really thoughtful change management, they aren't just like nice-to-haves. They are absolutely key to successful AI integration. It's about much more than just the technology itself. It's fundamentally about the people involved. Okay, so far we've talked about the really exciting potential and also the practical hurdles of AI. But as this tech gets more and more ingrained in our lives in healthcare, it forces us to confront even bigger questions, doesn't it? Questions about the very foundation of healthcare, things like trust, fairness, and that crucial human bond between a patient and their clinician.
Exactly. It really pushes us to consider, okay, how do we make sure AI isn't just effective, but also truly ethical, trustworthy? Researcher Majid, he stresses that these ethical issues, trust issues, they are huge concerns for AI in healthcare, not minor points. And one of the most, stark problems we've seen documented is bias in AI. It's a major issue. AI models, they learn from the data they're fed, right? So if that data reflects existing biases in society or in healthcare, and often it does, the AI can end up perpetuating those biases or even amplifying them, leading to unfair, inequitable outcomes in diagnosis or treatment recommendations for specific groups, like certain racial or ethnic groups.
And the real-world examples of this are, frankly, they're alarming. Our sources highlighted one algorithm. It was designed to identify patients with complex health needs, right, to give them extra care. But it ended up assigning significantly fewer Black patients to receive that extra care, only about 17.7% compared to what should have been closer to 46.5%. And the reason? It turned out the algorithm relied heavily on past healthcare cost as a predictor of need. And historically, care for Black patients in that system had cost less. So the algorithm essentially translated lower cost into lower need, a classic example of embedded bias. And this isn't just one isolated incident, is it? We've seen similar patterns elsewhere, like the Compass software, used in courts to assess recidivism risk, is found to overpredict the risk for African-American defendants while underpredicting it for white defendants. An Amazon recruiting algorithm famously discriminated against women. Facial recognition algorithms have repeatedly misidentified people from underrepresented groups, sometimes leading to wrongful arrests. In healthcare, though, the stakes are often even higher. These can be life and death decisions, influenced by biased algorithms.
Absolutely. And beyond bias, data security and privacy are just paramount, especially with something like mental health data, which is incredibly sensitive. Privacy and security become even more critical there. Patients absolutely need clear, informed consent about exactly how their data is going to be used, no surprises. And there's always a significant risk of data leaks or privacy breaches. It's a constant threat. That's why Dr. Shell emphasizes that AI models really need to reside securely within healthcare organizations, creating, as he put it, boundaries where access to outside public models isn't possible. Security can't be an afterthought. Proactive security measures have to be baked into these AI systems right from the initial design phase, not just bolted on later. Plus, you have to navigate this complex web of regulations, like HIPAA in the US, the FDA's Part 11 rules, and in Europe, the GDPR and the new AI Act, all designed to protect patient information. This can even create a really difficult ethical choice for patients sometimes. Do they prioritize protecting their privacy, or do they need access to potentially life-saving AI-assisted care that requires sharing data? It's a tough spot.
Then there's this thing often called the black box problem. It comes up a lot. Many of these advanced AI models, especially deep learning ones, are so complex, their internal reasoning is incredibly difficult, maybe impossible to fully interpret. You see the input, you see the output recommendation, but understanding how the AI got from A to B, that's the black box. And this is particularly critical when, say, an AI disagrees with a clinician's judgment, or when a clinician needs to explain the AI's findings or recommendations to a patient. How do you explain something you don't fully understand yourselves? This black box nature, it can also inadvertently cause algorithms to perpetuate those human biases we talked about if they're trained on unrepresentative data, because you can't easily inspect the reasoning.
It also raises that really thorny legal and ethical question we touched on. If an AI makes a mistake, provides an incorrect diagnosis, who's actually responsible? Is it the human clinician, who ultimately bears the legal consequences whether they ignore or accept the AI's output? Or is it the AI manufacturer, the company that built the algorithm? This uncertainty, it often pushes healthcare providers toward limiting AI's role, keeping it strictly as a tool, ensuring the human remains primarily responsible. It's a safer position legally, perhaps.
And this really brings us to a fundamental question, doesn't it? Can AI truly engage in the deeply human aspects of healing? Eric Cassell reminds us the goal of medicine isn't just curing disease, it's about the well-being of the whole patient, right? Promoting their individual purposes, their goals in life. And that means clinicians have duties that go way beyond just the physical treatment. Can AI offer compassion, for example, that uniquely human quality? Well, AI can certainly mimic empathic responses. It can be programmed to recognize facial expressions, maybe modulate its voice to sound calm, even simulate a gentle touch with a robotic hand. But this raises a really significant dilemma. If patients know the AI isn't human, that it doesn't truly feel, will the care feel genuine? Probably not. But if they're somehow led to believe the AI does care, that it has feelings, well, then you're creating a kind of delusion, aren't you? Our sources suggest, and it makes intuitive sense, that most people don't actually want pleasant but ultimately deceptive experiences. They want actual care, real connection. This suggests that AI's simulated empathy, however sophisticated it gets, will either be perceived as inauthentic or it simply won't be enough to replace genuine human compassion. Now, some people argue that empathy can sometimes cloud judgment in medicine, but that's usually an issue of too much empathy or empathy applied inappropriately, not empathy itself. Human clinicians can be trained and are trained to use empathy appropriately. That's a capability AI, lacking genuine feeling, doesn't inherently possess.
Right? And what about communication? It's absolutely vital in healthcare, isn't it? For gathering information accurately, for just the act of listening attentively, which can reduce anxiety, and for building that strong patient-doctor relationship, that trust. Now, AI can mimic some nonverbal cues, sure. Eye contact from a screen, facial expressions on an avatar, the tone of voice paralanguage. But these are really just surface-level behaviors, aren't they? Without genuine understanding behind them. AI can handle some verbal aspects, like listening for keywords, choosing words carefully in its responses. But sources suggest it collects information, rather than truly absorbing a patient's deeper concerns and feelings. The content it provides can also be limited, especially with those black box AIs we talked about. They often offer little justification for their conclusions. And as for attitude, can an AI truly convey genuine empathy and respect? It seems doubtful. So overall, AI's communication, while functional perhaps, seems to fall short of the deep human connection that's so essential in healing.
Yeah, and similarly, AI really struggles with what philosophers call recognition. This is central to how we form our identity, how we see ourselves. Patients, especially when they're ill, often grapple with how illness changes their self-image, their sense of self. For true recognition to happen, the recognizer, the person acknowledging you, needs to be seen as a credible judge of your worth, your personhood. AI has a really hard time here because, well, humans tend to doubt its inner experience, its sentience. There is an unbridgeable gap between reality and appearance, as some sources put it. This makes it incredibly difficult to view an AI, no matter how sophisticated, as a truly credible judge of our humanity. And the risk here is significant. Patients might feel their sense of being persons, individuals with values, is diminished if they're primarily interacting with machines, and that can negatively affect their overall well-being. And finally, let's talk explicitly about trust again, because it's so fundamental. While an AI might be incredibly reliable in its calculations, consistently accurate, that black box nature makes it really hard to trust why it's making the decisions it makes. Where's the understanding? And because AI fundamentally lacks human motivations, intentions, or feelings, it simply cannot possess goodwill towards patients in the way a human caregiver can. That erodes another basis for trust. It also doesn't face the same constraints as humans do, things like laws, reputation, fear of consequences. AI doesn't have personal relationships or fear blame in the same way. The whole challenge of making sure an AI's goals truly align with human values, the alignment problem, is still a major unsolved issue in AI research, which means ultimately, we can't fully trust AI on that basis either if its programmed goals somehow diverge from what's best for the patient. And all of this, all these issues, bias, privacy, the black box, the limitations in compassion, communication, recognition, trust, they point towards a really critical systemic issue, the responsibility gap. Our sources discuss how highly autonomous AI systems could potentially cause harm, serious harm, without any single human or entity being clearly morally accountable for it. Assigning moral responsibility to the AI itself is deeply problematic. Most agree AI doesn't have the necessary moral capacities like desire, suffering, the ability to genuinely understand, praise, or blame in a human sense. So the consequences of this potential gap are pretty significant. It could seriously erode trust, not just in specific AI tools, but in our entire healthcare and legal systems if harm occurs without accountability. It also removes a really crucial deterrent for potentially harmful actions. The threat of repercussions, of punishment that applies to humans just doesn't apply to AI in the same way. This could, worryingly, lead to more instances of harm occurring without anyone being held properly responsible. And there's also that practical worry of de-skilling we mentioned earlier. If clinicians become overly dependent on AI, relying on it too much, they might actually lose some of their own critical diagnostic or procedural skills over time, making them less able to step in effectively to catch errors or to manage situations if the AI fails or encounters something unexpected.
Wow. Okay, so we've definitely explored the exciting potential and some very serious challenges. It paints a really complex picture for AI in healthcare, doesn't it? So what's the path forward then? Is it just an all-or-nothing proposition when it comes to integrating AI? Do we just stop or go full steam ahead?
Well, when we try to connect this all to the bigger picture, I think it becomes clear that a really key distinction is crucial here. And that's the difference between AI that assists humans versus AI that substitutes for them. This is where the debate really shifts, I think. Assistive technology basically is something that helps a human perform tasks better, maybe saves them time, improves efficiency or quality. But, and this is the key part, it does not take over the human's core duties, their decision-making authority, or their ultimate responsibility. Think of a doctor's assistant helping with scheduling or paperwork, or even a smart speaker reminding you to take medication. Helpful tools, but the human is still in charge.
Right, that makes sense. An assistant. But then there's the other category, substitutive technology. And that's where the ethical significance really ramps up, isn't it? This is when an AI permanently takes over all aspects of a human's role, meaning the human basically entirely ceases to hold that specific position or perform those functions. It involves a complete transfer of the relevant responsibilities, the authority for making judgments and decisions, and all the associated duties and accountability that go with that role. But as you hinted, this distinction, it can get kind of blurry sometimes, can it? Leading to what our sources called hard cases. Like, for example, imagine combining multiple distinct assistive AI tools. Individually, each one just assists with one part of a job. But when you put them all together, maybe they could collectively perform all the functions of a human clinician, effectively becoming substitutive as a system. Think about breaking down, say, an anesthesiologist's complex role into several separate AI systems, one for pre-op consultation, one for real-time vital sign monitoring, another for automated medication administration. Is the system now substitutive?
Exactly. That's one tricky scenario. Another one is what some call Sorite's substitution. It's named after that old paradox, the Sorite's paradox. How many grains of sand do you need before you have a heap? 1. 2. 1,000,000. Where's the exact line? Similarly, with AI, you could have an assistant system that starts simple, but then gets gradually upgraded over time, adding more and more advanced functions, more autonomy, until one day, maybe years later, it's doing pretty much everything the human used to do in that role. When exactly did it cross the line from being an assistant to being a replacement? It's really hard to pinpoint. And then there's another one, assistant substitution. What if an AI substitutes not for the primary clinician, but for a human assistant who is part of the process? Is the AI assistive or substitutive in that case? Well, it's substitutive in relation to the assistant's role, clearly, but maybe it's still considered assistive in relation to the overall primary process or the main clinician. It gets complicated depending on how you frame it.
These examples really highlight just how complex this distinction can get in practice. It's not always clear-cut. So what's the core insight here? How should we be thinking about this as we move forward with AI in healthcare?
Yeah, the key insight, I think, the central point from this deep dive really is that substitution, this idea of replacing a human, it isn't some inherent quality of the technology itself. It's not like you can look at a piece of code and say, oh, that's substitutive. Instead, it's a relational property. It's relative to the specific role or the specific process we're talking about. Fundamentally, deciding whether AI is substituting for a human is a social and organizational matter, much more than it is purely a technological one. It's about how we structure work and responsibility. And this means our primary concern probably shouldn't just be whether AI can technically perform a task or a role. The tech will keep improving. The focus needs to be on the policies we put in place. Specifically, avoiding ethically negligent policies that allow for the complete transfer of decision-making authority, duties, and crucially, responsibility from humans to machines without the right safeguards, without considering the consequences.
Okay, that really shifts the focus, doesn't it? From just what the technology can do to what we as a society should allow it to do and how we manage it. So given that, How do we navigate those inevitable moments when a human clinician's professional judgment conflicts with an AI's recommendation? It's bound to happen. I mean, blindly accepting the AI could be wrong, right? The AI is flawed. Maybe it's missing some crucial context that the human picks up on. But blindly rejecting the AI is also problematic because that ignores the AI's potential advantages, its ability to process vast data or spot subtle patterns.
Exactly. It's a real dilemma. And this is where it's important to understand why AI, even super powerful AI, isn't necessarily an epistemic superior, meaning it doesn't automatically know better than an experienced human clinician. Even with access to maybe more data than any human could process, AI lacks certain crucial human intellectual strengths, or epistemic virtues, as philosophers might call them. For instance, it generally lacks what we might call deep explanatory understanding. It might know what the right answer is or what pattern predicts an outcome, but not always why in a truly comprehensive, causal way. It's like a child knowing their house burned down because of faulty wiring. Maybe they were told that. But they don't understand the underlying physics of electricity and combustion that explain how the faulty wiring actually caused the fire. AI often operates more at that surface level of correlation, not deep causation. AI also typically lacks belief integration, that incredibly complex, interconnected web of background beliefs, experiences, and common sense that allows humans to sense when something just feels off, even if the data looks okay. Or to understand subtle nuances, patient context, things that go beyond just the raw data points. This holistic understanding is absolutely crucial for good medical decision-making, where context, intuition, and weighing multiple factors are everything.
Okay, so if AI isn't automatically superior, but it still offers value, how do we combine the strengths? This leads us to a proposed ethical framework that came up in the sources, called the rule of nudge. Can you unpack that? The core idea, as I understand it, is pretty straightforward. Assistive AI provides a nudge, right? A recommendation, an alert, some kind of input to the human clinician. And this is the crucial part, the human clinician always retains the final decision-making power and, importantly, the ultimate responsibility for the patient's care. The buck stops with the human.
Precisely. That's the foundation. And the rule of nudge also outlines a really important duty for the clinician in this scenario. If the clinician finds themselves disagreeing with the AI's recommendation, they don't just dismiss it out of hand. They have a responsibility, a duty, to seek further justification before they decide to override it. This might mean, consulting another human expert, maybe quickly reviewing some more literature on the specific point, or if the AI system allows, trying to critically examine the data or logic the AI used, looking for potential flaws or missing pieces. The key is the clinician must always be able to clearly justify their final decision, whether they follow the AI or go against it. The benefits of this kind of rule, this framework, seem pretty substantial. It allows us to leverage the power of even complex black box assistive AI in a beneficial way. But it crucially maintains that human oversight, that human judgment, and that clear line of accountability. It helps prevent the creation of that dangerous responsibility gap in critical medical decisions.
Yeah, that framework, the rule of nudge, it really sounds like a potentially powerful way to keep the human element with all its complexities, its intuition, its ethical judgment, right at the absolute center of healthcare, even as technology advances, doesn't it? So as we wrap up this deep dive today, it's incredibly clear that artificial intelligence in healthcare isn't some simple yes or no question, is it? It's an incredibly powerful tool, undeniably, with just immense potential to do good. But its integration, as we've seen, is really fraught with challenges ranging from the practical stuff like fragmented data to inherent biases baked into algorithms, all the way to these profound ethical questions about trust, responsibility, and the very nature of human care itself.
Absolutely. Ultimately, I think what we've really seen today is that the future of ethical and effective AI in healthcare, it hinges not just on more technological advancement, which will surely come. It hinges just as much, maybe even more, on thoughtful, human-centered policies and governance structures. That distinction we discussed between assistive AI and substitutive AI, it's really crucial, isn't it? It serves as a constant reminder that we as a society ultimately get to decide how much authority and how much responsibility we're willing or should be willing to delegate to these increasingly intelligent machines.
Yeah. Perhaps the biggest takeaway then for you, our curious listener, is that the ultimate deep dive in this new era of AI won't just be into the technology itself, into AI's growing capabilities. It will also have to be into our own evolving understanding of what it truly means to provide care and to receive care, what it means to be well-informed citizens and patients, and what it means to make responsible, ethical decisions in an increasingly technologically complex world. So what stands out most to you from this deep dive today? Keep exploring.